Hi, this is Josh, pharmacist with pharmacisttips.com. We're going to go over the 10 most common antidepressants. Number 10 is mirtazapine. Mirtazapine, sold under the brand name Remron. It's a tetracyclic antidepressant as well as an alpha-2 antagonist. It increases the release of both norepinephrine and serotonin. Typical starting doses are 15 milligrams at bedtime. Common side effects can include weight gain, constipation, increased appetite, dry mouth, and drowsiness. Number 9, Trazodone. Trazodone, it used to be sold under the brand name Desaril. I don't believe that's available anymore. It inhibits, Trazodone works a few different ways, but some of the main ways it works, it inhibits serotonin reuptake, it affects the 5-HT receptors, and it also blocks histamine. Typically, we see the starting dose at 150 milligrams at bedtime, and typically that is taken with a small snack or after a meal. The food does seem to help it last all night. Off-label, we see that is the most common use for sleep. A lot of times, if people are having difficulty sleeping either with or without depression, we'll see this used. Common side effects can occur nausea, vomiting, dry mouth, dizziness, drowsiness, headache, fatigue, nervousness, as well as blurred vision. Number 8, Paroxetine. Paroxetine, sold in the U.S. under the brand name Paxil. It is a selective serotonin reuptake inhibitor, or SSRI. It's generally dosed at 20 milligrams, often in the morning. Common side effects can include excessive sweating, decreased libido, constipation, dry mouth, nausea, decrease in appetite, dizziness, drowsiness, headache, and insomnia. Number 7, Venlafaxine. Venlafaxine in the U.S. is sold under the brand name Effexor XR. It is a serotonin norepinephrine reuptake inhibitor. Common starting dose, generally 37.5 to 75 milligrams once daily with food. Common side effects can include excessive sweating, weight loss, decrease in appetite, nausea, dry mouth, dizziness, drowsiness, insomnia, as well as decreased energy. Important thing to note on the side effects with this medication as well as the others, they will often improve the longer you are on the medication. Certainly worth a conversation with your healthcare provider if they believe that you should continue the medication, or if your dose needs to be adjusted, or if you need to try a different medication. Number 6, Fluoxetine. Fluoxetine, U.S. brand name Prozac. I think most people, when they hear antidepressant, Prozac is often one of the first things that comes to mind. It is a selective serotonin reuptake inhibitor, like many of the medications on this list. Starting dose on fluoxetine or Prozac is 20 milligrams daily with or without food. Side effects can include a change in libido, decrease in appetite, nausea, diarrhea, dry mouth, drowsiness, headache, insomnia, nervousness, as well as a sore throat. Number 5, Citalopram. Citalopram is another SSRI on our list. It is sold under the brand name Celexa in the U.S. Typical dosing on this is 20 milligrams once daily with or without food. Common side effects, you may notice, are similar to the others on the list: excessive sweating, nausea, dry mouth, drowsiness, and insomnia. Number 4, Bupropion. U.S. brand name Wellbutrin, also used to be sold under the brand name Zyban, used for smoking cessation. Dopamine norepinephrine reuptake inhibitor. Initial doses typically 150 milligrams once or twice a day, depending. The XL or extended release is often dosed once a day. Typically we see that 150 milligrams once a day. The SR form, sometimes you start on the 150 daily for 3 or 4 days and then go to twice a day after that. Of course, your healthcare provider will determine the appropriate dose. Common side effects can include insomnia, headache, dizziness, excessive sweating, weight loss, dry mouth, constipation, nausea, blurred vision, sore throat, and a stuffy nose. Number 3, Duloxetine. Duloxetine, sold in the U.S. under the brand name Cymbalta. It is a serotonin norepinephrine reuptake inhibitor. We often see it used in patients who have chronic pain. Starting dose generally is 30 to 60 milligrams a day. Common side effects can include weight loss, decrease in appetite, abdominal pain, dry mouth, drowsiness, fatigue, and headache. Number 2, Sertraline. Sertraline, sold in the U.S. under the brand name Zoloft. Zoloft, or Sertraline, is a SSRI, or selective serotonin reuptake inhibitor. Initial dosing, generally 50 milligrams. The common side effects can include diarrhea, nausea, dry mouth, dizziness, drowsiness, and insomnia. And the number 1 most common antidepressant on our list is Escitalopram. Escitalopram, sold under the brand name Lexapro in the U.S. It is an SSRI as well. And initial dosing on this typically is 10 milligrams once daily with or without food. Common side effects can include nausea, diarrhea, drowsiness, insomnia, and headache. Just remember, this is for informational purposes only. This is not medical advice. I do appreciate thank you for watching this video. Please like and subscribe. I've also, many of the medications mentioned in the video, I have more detailed videos about each individual medication. I will include a link to those in the video description. Thanks again for watching.